everyone.
Good morning.
So today we're going to be asking some questions on COVID. It is we're in our third lockdown, and with Auckland being in a level 3 lockdown, obviously it's causing a lot of distress to people. But I think most people realise that we can't let this COVID out into the community, and we have to do everything that we can to ensure it doesn't go any further. But we have some questions today to the Prime Minister and to Minister Hipkins about the government's response and also on vaccines.
What particular areas do you think they need more scrutiny on?
Well, I think it's really clear that the testing that's been undertaken has been somewhat limited compared to what most people would have thought. But also they seem really reluctant to start undertaking daily saliva testing, which has been recommended by people like Professor Baker, and seems something that New South Wales seems to be doing. It obviously is far less invasive than the nasal test, but also it's if you have them every day, you're going to end up starting to pick up any Covid-19, I would have thought. So that's just seems strange to us that they haven't been doing that.
What precisely do you think the government should be doing in terms of mandating testing for those indirect border workers like case B?
Yeah, I think it's really important that they obviously work on the basis. We don't know right at this stage whether or not the mother at the centre of this has got Covid-19 through her work, but it does seem remarkably remiss that there isn't a mandated testing. And the mandated testing, I can understand people would be very concerned about the nasal test because it's not something you could have every day because of the nature of it. But certainly a saliva test needs to be mandated. And the fact that the employers can or might not add or information to the Ministry of Health spreadsheet, basically, data collection, seems really slack.
Why do you think it's taken so long to move on to live testing, or seems to kind of is it penny pitching, or is it just kind of Ministry of Health?
It is very interesting because one of the reports was that from some people involved in this, virologists, is that there seems to be a reluctance to adopt and to adapt to new technology, whether or not it's that they've already invested so heavily in the other testing. But clearly this is a fast-moving scenario when it comes to science. So we need to be picking up every piece of new science that we can and seeing how can we adopt it and also adapt if it is going to be easier and better and then more easily complied with and more readily complied with.
How far out would you ideally put those saliva tests? Would it be sort of households and contact, or sort of how far into a rural field?
Yeah, it's a really good question. I think people need to, we need to obviously be guided by the medical advice, but you'd have to start wondering, wouldn't you, whether or not the testing itself, if we were doing those saliva tests every day, for instance, in quarantine or managed isolation facilities, the chances of an understanding that there are always false negatives and false positives with any of these tests, daily tests would be far more likely to pick up any issues. So question whether or not you'd ever have to take it out that far. But the other thing that really has to be questioned, I think, is whether or not it is a time for the government, or should have been investing in looking at managed isolation quarantine facilities outside of the Auckland CBD, and to lock down yet again a third of the population and all of the ramifications not only for Auckland but also for the rest of New Zealand is actually a huge call, and it's obvious that COVID-19, even though we're getting obviously vaccines starting to come in, this is going to be a problem for the world for some time, and whether or not we should be the government should have and be undertaking work now for facilities outside of Auckland.
But with that argument, though, the infrastructure that goes along with that just isn't there in those smaller cities. Isn't it a bit of a no-brainer that it has to be in Auckland and it has to be centred in Auckland?
Well, that's an argument, but if it's a long-term problem for us as a country, then there's also an argument to understand that probably putting this most infectious virus that we've seen a very dangerous virus that we've seen coming into the world and having to be dealt with, and possibly other pandemics in the future, we may need to consider that. And I just think that, you know, we've had it now for almost a year in and out of New Zealand. We've been very lucky because we have, you know, very isolated, physically isolated from the rest of the world, and even then we can't keep it out.
Is there another element of risk in terms of South Auckland being so proximate geographically? Many of the people working in MIQs and just being a socio-economically low and vulnerable community. I mean, how do you deal with that? Or is that just something that's going to have to be part of the risk profile?
Well, I just think it's really dangerous, actually, and that's one of the issues as well. I think the fear has always been that COVID-19 gets into a community where there are a lot of people living in homes together, where there's a lot of community events, whether it's churches or other organisations that people attend, and where there's a lot of social mixing, and that is one of the big issues. So I can see why there is a lockdown. The issue is how do we avoid them in the future?
So how do you...
This is Wilson and Baker also call for a reduction of the number of people coming to New Zealand. That's something that the Kiwis also support. Has the government got that number, which is about 2,000, 2,500 a week, right, or does national support lowering that?
Look, I'm really concerned about making it even more difficult for Kiwis to come home. Look, I understand from people who are living overseas and trying to get a space in MIQ facilities, just the awful hardships that many of them are undergoing, and mental health issues are also important. I think it's not that hard to do things right if we actually have the testing in place. And daily saliva testing is something that is clearly being used in New South Wales to very good effect. It's something we could be doing. We could make it easier for people to have some assurance around the facilities, and also, how long is COVID-19 going to be in the world?
Sorry, can I just clarify? Are you calling for daily saliva testing of returnees and border workers?
Yeah, I think it's really important that the government talk to us about and tell the public about why we don't have that now. We see it as something that could be done in addition for returnees, so not instead of the nasal test for the returnees, but in addition. We've looked at how can we make it safer and people have more confidence in those facilities, and this is clearly one of those things that could happen.
So what do you actually propose that? A Kiwi Islamic State terrorist was arrested on the Syrian border. Do you think the government should help facilitate her return to New Zealand?
I would say that most New Zealanders, like me, would consider such a person not someone that we would go out of our way to assist back to New Zealand, other than obviously meeting the obligations that a government has to. The government or the Prime Minister has not discussed it with me. We obviously have national security implications, and without any more details, it's hard for me to comment.
What are you actually proposing? What if you could set up MIQs outside of Auckland? What would that look like?
Well, I think that's something that the government needs to actually consider how that would work. But others, yeah, but yeah. Well, there are obviously military camps available. There are. Obviously places already, and it was something that the government last year talked about at one stage, or part of the government talked about at one stage, but for some reason that hasn't been progressed. And it may be that they see that there are issues with infrastructure. Well, right at the moment, the infrastructure of Auckland is pretty much closed down. So I'd say that there are risks and benefits from both approaches, and there's no point ruling stuff out because it might be inconvenient.
Do you have any location you can point to, though, that has a large enough hospital but is also sparsely populated enough that it's lower risk? Well,
that is one of the issues, so that they need to be able to deal with that. But there's also things like medivacs to take people to hospitals if they need them. I mean, it's not as though everyone coming into MIQ is going to end up in a hospital or even has COVID-19. So there are other ways around it. I just think that they need to just not shut that door. This moment they shut that door to it, it actually puts a huge burden on the people who live and work in Auckland. We've got one more.
Should we be trying to block the return of New Zealanders with links to terrorist organisations?
Well, that's something the government hasn't discussed with us, but I think we need to consider all of these things. It's hard to do it because, of course, if people have New Zealand citizenship, they do have a right to come here. There are some times that citizenship, whether or not it can be removed, is something the government should think about. But look, we don't have the information on this particular person.
What about when there are children?
Well, it's one of the issues.
Doing everything we can to try and get them back, and
It's very hard. I mean, it's a very hard situation, and that's why it's hard for me to comment when the government hasn't actually briefed me on it.
On the vaccine, the government's promised that everyone in New Zealand, visa or not, will get the vaccine. Do you think other Kiwis overseas who work for the government, embassies, consulates, should they also provide?
Yeah, actually, this is an issue. So, for instance, we also have Kiwis overseas who work for the New Zealand government, who are in many cases in COVID hotspots, and you'd have to say, sorry, why aren't we looking after these people? The other thing is we're asking those people in those hotspots, those often public servants working there, to deal with people who are trying to come back to New Zealand, some of whom may have COVID-19. So yes, I would have thought so. The other thing is that there are diplomats living in New Zealand here from overseas who can't get, who are not on a vaccine program, and that's something that we need to look at as well.
So they should be vaccinated?
Well, I think we should be. No, I think that they're possibly not ahead of everyone else, but they certainly do need to be getting vaccinated. We need to have a country that is pretty much vaccinated.
So far, New Zealanders have really given Jacinda Ardern government a bit of a tick for COVID-19 coverage. You might disagree with that, but that's my assessment.
Yeah.
Do you think with this latest outbreak, on the brink of being an outbreak, because of the failings in testing or the failures to step up, Kiwis might start to think this one's on you?
Well, they hopefully will actually question where it's right to question, and that's what we're going to do. I mean, as opposition, we could be out there screaming and shouting and carrying on, but I actually think that's New Zealanders don't like that sort of behaviour. What is really important is that when the government fails to learn the lessons of failures, that's the problem. So where we have, when we found out that border staff were not being tested, that was in mid last year, after the government said they were being tested, that was wrong. When the government told us that New Zealanders would be the front of the queue for vaccines, it turned out we were nowhere near a front of any queue for vaccines. That is something people should be questioning. So I think the point is that we know this is difficult, but that's why I'm saying the government shouldn't close off options where it comes to facilities and testing systems and obviously also treatment.
On vaccines, the vaccine arrived in New Zealand yesterday around the same time as Australia. Do you think that's about as soon as it could have come realistically?
Well, I don't.
You have David Seymour who says we should be on the same timeline as the UK.
Well, I would have preferred us on the same timeline as the UK, and I'm sure most New Zealanders would. But the fact is that it's enough is hopefully come in now for the border-facing staff. But whether or not that should be extended out as quickly as it could be is another. I mean, it's just fact is that you can't do it until you've got it. But which is why the government should never have promised New Zealanders they're at the front of the queue, because clearly we weren't. Thank you very much, everyone.
Thank you.
Still ahead of Australia.